Hi and welcome back to another video of Medic Notes. This video is on eczema. Eczema, also known as atopic dermatitis, is a chronic skin condition characterized by inflammation and irritation of the skin. It is a common condition that affects people of all ages, but it is most commonly diagnosed in children. Eczema typically presents as red, dry, itchy, and rash-like patches on the skin. These patches may become scaly, cracked, and even bleed in severe cases. The exact cause of eczema is not fully understood, but it is believed to be a combination of genetic and environmental factors. People with a family history of eczema or other allergic conditions, such as asthma or hay fever, may be more prone to developing eczema. Environmental triggers such as irritants, allergens, and stress can also exacerbate eczema symptoms. There are many types of eczema, which are atopic dermatitis, contact dermatitis, nummular eczema or discoid eczema, dyshidrotic eczema, seborrheic dermatitis, and stasis dermatitis. First, for atopic dermatitis. This is the most common type of eczema, and often affects children, although it can persist into adulthood. It is believed to be caused by a combination of genetic and environmental factors, and is associated with a personal or family history of other allergic conditions, such as asthma or hay fever. Atopic dermatitis typically presents as red, itchy, and dry patches on the skin, often occurring on the face, neck, and extremities. The second one is contact dermatitis. Contact dermatitis is caused by direct contact with an irritant or an allergen. There are two types of contact dermatitis. Irritant contact dermatitis, which occurs when the skin comes into contact with an irritating substance, such as detergents, soaps, or chemicals. And allergic contact dermatitis, which occurs when the skin has an allergic reaction to a specific allergen, such as nickel, fragrances, or latex. Contact dermatitis typically presents as redness, itching, and sometimes blistering or oozing of the affected skin. Third one is nummular eczema. Nummular eczema, also known as discoid eczema, is characterized by round or oval-shaped patches of inflamed, red, and scaly skin. It is often triggered by dry skin, and may occur on the arms, legs, and trunk. Nummular eczema can be particularly itchy and may become chronic if not properly managed. For dyshidrotic eczema, it is also known as hand eczema or foot eczema, affecting the palms of the hands and soles of the feet. It is characterized by small, itchy blisters that may be accompanied by redness, scaling, and cracking of the skin. Dyshidrotic eczema can be triggered by factors such as stress, allergens, and excessive sweating. Seborrheic dermatitis. This is a type of eczema that affects areas of the skin with a high concentration of oil glands, such as the scalp, face, particularly the eyebrows, sides of the nose, and behind the ears, and upper chest. It is characterized by red, scaly, and greasy patches of skin, and may be associated with dandruff or cradle cap in infants. Stasis dermatitis, also known as venous eczema or gravitational dermatitis, occurs when there is poor circulation in the lower legs, often due to venous insufficiency. It is characterized by redness, itching, and scaling of the skin on the lower legs, and may be associated with swelling, varicose veins, and skin discoloration. In summary, the symptoms of eczema can vary from person to person, and may include dry and sensitive skin. Eczema-prone skin tends to be dry and easily irritated, making it more susceptible to eczema flare-ups. Itching and redness. Eczema often causes intense itching and redness, which can be distressing and may lead to further skin damage from scratching. Rash-like patches. Eczema typically presents as rash-like patches on the skin that may be red, scaly, and inflamed. Cracking and weeping. In severe cases, eczema patches may crack and ooze, leading to discomfort and potential risk of infection. Thickened skin. Over time, repeated scratching and inflammation can cause the skin to thicken and become lichenified, leading to a leathery texture. Disrupted sleep and quality of life. The itching and discomfort caused by eczema can disrupt sleep and quality of life, leading to fatigue, irritability, and emotional distress. For investigations, patch tests are performed if contact allergic dermatitis is suspected. Bacterial and viral swabs should be taken where supra-infection is suspected. Skin scrapings to rule out secondary fungal infection should be considered. Treatment for eczema focuses on managing symptoms, preventing flare-ups, and reducing inflammation. It may include the use of topical corticosteroids or other topical medications, moisturizers to keep the skin hydrated, avoiding triggers and irritants, lifestyle changes such as stress management, and in some cases, systemic medications or phototherapy. Regular emollients can be applied as bath additives, soap substitutes, or directly to the skin. These are the mainstay of treatment in eczema, as they limit water loss and reduce the amount of topical corticosteroid required. Sedative antihistamines are useful if sleep is interrupted. Topical steroids, available in a range of potencies. The side effects of topical corticosteroid therapy need to be considered when patients are using them for a long period of time, although steroid phobia and undertreatment are often more of a problem. The least potent corticosteroid that is effective should be used for the shortest possible time. Topical calcineurin inhibitors such as tacrolimus and pimecrolimus may be useful steroid-sparing agents, particularly on the face. That's all for this video. Thank you.